Right. Dr. Dart, can you just tell us your first, your last name, and your title, please?
Um, Dr. Bruce Dart, D-A-R-T, Executive Director, Tulsa Health Department.
Okay, and Dr. Dart, our latest executive report was on Friday, but what's the current situation right now in Tulsa County as far as community spread of COVID-19?
So I think we have a little bit of good news. We still have widespread community incidents, but all of our trends, our 14-day case counts, our 4- and 7-day rolling averages are starting to see a downtrend, which is great news, which, keep wearing those masks. So,
That was going to be another question. So that's good news that we're seeing a little bit of a decline. Is that in the last week or 2 weeks?
in the last week.
Why do you think that is?
Well, I think people are becoming more compliant around the 3 W's. Watch your distance, wear your mask, wash your hands. I mean, those are our only tools to mitigate spread. And I think we're seeing more and more of that. I'd like to see more and more of that all across Tulsa County and all across the state, because the data is telling us that it truly works to mitigate.
Of those active cases, I believe there's maybe 1,300 or so when I last looked. What are the ages of those positive cases?
I personally haven't checked. We do know that the positive cases we have been receiving for the past several weeks have been in our younger age groups, our 18 to 34 and 34 to 49. And so I'm assuming that it's still that will cover our active cases as well, just because of the time frame in reporting and onset. But frankly, I haven't looked specifically in a couple of weeks.
And how is the hospital capacity looking right now in Tulsa area hospitals?
So they continue to be very, very busy. Good news is that we still continue to have bed capacity, which is what we want. But we're still concerned. I mean, it's still difficult to fully staff and equip all the beds. We're all drinking from the same PPE well. And there's nursing shortage all across this country, and so we're experiencing that. So while we do have beds, I think we're really monitoring staffing equipment very closely as well.
And I'm sure Dr. Deborah Burks was here from the White House Task Force on Sunday. I guess one of the first questions, were you at that meeting? And if you weren't there, why were you not at the meeting?
So I was not at that meeting. I was not invited to that meeting. I know that Mayor Bynum specifically asked that I be allowed to attend that meeting, but his request was not granted. So, it was my meeting. It was the governor's meeting, and I don't get to say if I can go or not. So,
what would you have liked to tell Dr. Burks as far as the coronavirus and how we're tackling it here in the city of Tulsa? Would you have told her anything?
I would tell her that I appreciate the messaging that she's been giving around the 3 W's and how we can all work together to increase people actually doing that and being compliant around those 3 W's, and would let her know where our data was here in Tulsa County and what we're seeing and the impact on our community, both from a health perspective, a social economic perspective, and an emotional health perspective, because we know how impactful across those 3 areas that this virus has been. And I think sometimes we just talk about numbers, but we really have to remember those numbers are people. And we have to talk about how this is impacting people in the myriad of ways that it truly has, both from a health perspective and a mental health perspective. So it would have been nice to have had that broad conversation.
And even though we're seeing this decline, are there any concerns or any worries that you have right now?
Well, several schools have made the decision to open up in the classroom. And we know that when people come together, there's potential for transmission and potential for increasing cases. So I'm really happy about the current decline in trends. I am concerned, we still have widespread incidents in our community. I am concerned about schools starting in the classroom, even though I'll be the first one to say and support that in the classroom is a much more conducive platform to learning. It's still a risk situation. So hopefully students, faculty, teachers will continue to take precautions, and hopefully we won't see a surge in cases at the school start.
So I know you are concerned about that. We did see over the weekend, I don't know if you saw the reports of Georgia schools. They started in person and there were all the, hundreds of people had to quarantine. Do you think something like that we could see here once schools start to reopen or?
So if you look at how COVID-19 has hit our community, it really mirrors what's happened all over the country. In the Midwest, we started to experience incidents at a slower rate than both coasts, and so we do follow, we do track what's going on both coasts. We track what's going on in the South, and it seems like we do seem to experience the same trends that other communities who are seeing, who are maybe 3 or 4 weeks ahead of us. So I think it's a very distinct possibility, and that's why it's really critical to continue to promote the 3 Ws and really watch your distance and wear your mask. And hopefully we won't see the same kind of trend that they're seeing in Georgia right now.
Besides the 3 Ws that you keep talking about, is there an additional safety measure that schools can take to prevent the spread?
It just continued to, I think, to be vigilant. And we've heard several stories across the country about people going to schools when they even had a positive test. So it's doing the right thing at the right time and continue to do the right thing at the right time so that we can mitigate spread. And if you're sick, stay at home. I mean, and I know people want to be, especially kids who won't be back in the classroom. They would want to be back with their friends. But if you're ill, if you're experiencing symptoms, you should not go.
And what is your message to all those parents who might be, scared to take their kids back to in-person learning?
I support their fear, because if I was sending my children into an at-risk environment, I'd be fearful as well. I also understand that it's really difficult to do virtual at home and to educate your kids at home. And so it's an extremely difficult and complicated situation. And that's why we make our recommendations based on health and safety, knowing that there's other issues and other variables that we have to take into account, that really, for the most part, isn't our main focus. And because we want to keep people healthy, we want to save lives, and no matter what, this year and this fall, it's going to be a difficult environment. It's going to be difficult learning both virtually. It's going to be difficult even in the classroom because of our guidelines to keep people apart. So it's not going to be the same. I understand. I'm very empathetic to parents and compassionate to the feelings that parents are experiencing right now. And we're just trying to do everything we can to keep them and the children, their families, and their school systems as safe as possible. And we will do all we can to help mitigate the spread of this virus.
And besides the traditional schools, what is your opinion on athletic teams practicing again, with Friday night football starting in a couple weeks, extracurricular activities, and maybe other student organizations that are coming together as a group? Like we saw OSU's off-campus sorority team, 23 of their members tested positive. What do you think about big groups of people like that coming together?
So I think the data is very clear. When big groups come together and they don't follow the 3Ws, spread happens. And it's obvious now. And data is, we keep getting hit upside the head by the reality in the environment when people come together. And so the same thing with sports teams. And I quantify this by saying I'm a huge sports fan. I love watching sports. But at this juncture, with a degree of incidence in our community, these contact sports especially aren't very safe for kids, whether it's high school, college, even professional. We can't put kids in a bubble like the NBA, and Major League Baseball has shown that they're not in the bubble. Transmission occurs. So it's a really tough, because there's no more tradition than high school football. I mean, in this country, it's number one in so many places, but at this juncture, just looking at what our incidence and community spread is telling us that it's just not very safe right now.
I believe we've already asked you this before, but maybe just briefly, should universities and schools test each student and staff before they arrive on campus? If they do conduct this test, how many days prior is it recommended?
So it's really difficult just to, we're testing, everybody wants to test. But to test someone, to let them back on campus, they could be tested today, negative today, and then exposed tomorrow, and then incubated and become shedding virus when they're on campus, thinking they're probably safe. So I really, but that's a really good question, because we have to think about what our testing strategies are. And, you know, at this juncture, we've been using PCR, which is really the gold standard. It's a nasopharyngeal, but, you know, it takes several days to get results back. And, you know, there are better rapid test methods coming on the market. I think we have to look at if we can get these rapid test machines, make them available to all school systems, K through 12 and secondary schools, universities, so that we can do rapid tests and get rapid results, so that we know really what actions to take. Because to test you before you get on campus, knowing that you could be exposed at any time, we're going to have to do rapid testing no matter what. And so I think that the question really is that at this juncture, do we want to sacrifice speed for reliability? I think right now, with all the schools coming together, speed is kind of the essence that PCRs can't give us.
Talking about testing, I saw an article. Do you think that saliva testing is effective? Is it effective at all?
So we've been researching that, and we're hoping that it is. News came out over the weekend about the I think from the Yale University study that shows that they've been able to verify saliva testing. I don't know what it's going to take to get those machines out everywhere, because we need them en masse, and so I know the FDA just did an EUA emergency authorization for these machines, and which is great, and I think that's tremendous, especially if we can verify for reliability. So that's good news. The bad news is that what's the logistics for getting it out all over the country where we need it? Because, you know, we all need this at once, and I know, you know, we can scream or yell loudest, but how we get it is really the big question.
We're talking about money and we're talking about time, right? So
yeah, exactly. Those two things that so far have been against us this whole time.
right. There's millions of people in the U.S. Well,
Yeah.
the other question. So there was an email sent out last Friday by the Tulsa Health Department mentioning how one of your quotes, I believe, in a political ad was taken out of context. I don't know if you wanted to comment on that, and which political ad is it?
You know, there was an ad, and it was, you know, when I was asked several weeks after the rally if we had attributed cases to the rally, you know, I answered by saying that, reminded the reporters that there were several events that weekend, and we're just connecting the dots, and we're getting cases, we're connecting dots, and we knew that we had several large indoor and outdoor events, and so just to remind people that these indoor and outdoor large events contribute to transmission. Well, after that, you know, my words connect the dots came out in a political ad, and frankly, I just saw one this morning from the DNC, and then but last Friday it was a political ad directly against Mayor Bynum, and you know, my words talking about this virus should not be used in a political context, and we tried to stay apolitical, and I think it's very important that public health continue to stay apolitical and just do the work that we can to keep people safe and mitigate virus, and to take three little words and present them out of context to attack people. I just find outrageous, and I'm extremely unhappy about that. You know, we need to focus on keep people safe, and focus on getting people elected is not my focus. and you know, and so it's just we're in that time of year, and I understand that, but I don't want any focus away from what we need to do to keep our community safe and keep all of our residents healthy, and to do things like that. I just find it unimaginable and disrespectful as well.
Especially right before election. I mean, you're just trying to do your job. So
absolutely.
And we are very curious to know. So the Tulsa Health Department has been working on this since mid-March, or probably even before. You have been tracking trends, you know, all over the country and the world. What is a normal day for you as the executive director of the Tulsa Health Department? You know, kind of take us through your day. Are you getting calls from the community? Are you looking at graphs? You know, what is it that you're doing?
You know, yeah, I don't know what a normal day looks like, feels like anymore. I truly don't. I mean, pretty much 24/7 for me, my life is COVID intertwined, and everything I do, there's a couple of times I get to do something that's not COVID related, but they're pretty rare and pretty few and far between. But my day is all about meeting with our team, and we have a great team here at Tulsa Health Department. department. Thank goodness, because I think things would be much worse for our community if we didn't have the team that we have here. But you know, we're all about mitigating, stopping spread, and keeping people safe, and we're doing activities to do that. So I'm on a million Zoom meetings. I do take a lot of calls from the public. I respond to a lot of emails from the public. We follow the data. I've got great data people here. We sit down, and so I truly understand what's occurring. And because if I don't get it right, then I'm responsible for putting out incorrect information. I never want to do that. Whether it's intentional, you know, it never would be intentional, but unintentionally, if I'm wrong and put out information that's not correct, and you know, people hopefully, you know, could possibly make bad decisions. So it's important that we follow the data, that we understand the data very closely, and we get it right. And so we spend all day long, and for me, that starts from the time frame which I get up, because I get up and grab my phone, and there's a lot of emails and texts, and then through the day and through the evening, and then just start all over the next day. So we're all about coming together as a team here at the health department. We come together, and this entire department's been involved in their response. We've had staff who, that's all they've done since February. And so in fact, we were talking this morning at our incident command meeting, but do you remember what it was like just to be normal, and what a day in the life of public health was back in January? And you know, no one does. It's like every day's March 6th, and it's Groundhog Day every single day.
Goodness. All right. Is there anything else that you'd like to mention that I did not ask you?
You know, I know there's a lot of fear and anger going through the community about the virus now, and you know, we can mitigate fear and anger by really finding information from trusted sources that helps you make informed decisions. So, and I think Tulsa Health Department is a source of information that will help you make the right decision. We don't want people making decisions in you know, fear. I don't want people to be afraid. You know, if we come together on this and we stay together, we can beat this virus down. We can beat it back. I mean, I said several weeks ago, if 95% of people in Tulsa County wore masks, we could grind this to the dust. I think the director of the CDC made a similar statement nationally. Well, we could do this in our county, in our state, but we need people to come together and understanding the why behind some of these recommendations and this guidance. So if anybody has a question, call me, email me, you know, call our staff, call our department. We're here to provide the right information, that it's just based on the data and information that we receive. And you know, we just want to tell people what the truth is, and what the truth is based on what the data is telling us. And if people want to be part of the solution, and it's what we want, and want to go forward, let's just do this together, and let's stop fighting, because you know, this virus is enough fight for all of us. Let's focus on that.
All right, and hopefully we won't see an uptick in cases once schools start going in person, right? So
that's what we hope. And you know, so the 3 W's.
The 3 W's.
Wear your mask, watch your distance, wash your hands. Let's continue to support that. Let's continue to message that. Let's continue to communicate that, and all that you guys do yourself helps so much in getting that message out. Because those 3 simple things really can protect people, can keep people safe, and can beat this virus, which is what we're all, you know, that's our big goal now, is to beat this virus, and that's our reality. And we're not going to stop working until we get it done.
All right. Well, hopefully we'll spread the word. And thank you so much for making the time again to talk to us about this.
You bet. You stay safe, all right?
Thank you. You too. Stay safe.
Okay.
Bye.
Bye-bye.